Hello there. Welcome to our second live this week, back to back. It's great to be here again. Thank you for joining me yesterday when we spoke about bunions. Today we are talking about open heart surgery, which is quite a significant scar. So I am really excited and pleased to be talking about this. So thank you for putting it on the list. If you're wondering what list I'm talking about, inside the Radiantly Alive Woman, which is where we're doing all of these lives, there's an announcement board in the front. You'll see that under announcements. And inside here, I'm asking women to write down scars that they're interested in. So open heart surgery has come up a few times. So let's get more clear around the importance of this scar, because it is a very significant scar in its size, in its location, and in the kind of severity for the kind of reason behind getting this type of surgery. So I am, like I said, really excited to just go into this with you all. And if you have questions, please ask away. Ask as many as you would like. I'm here exactly for this reason, to help give you answers and help give you a forward direction. So if you're here live with me, you get the benefit of asking me questions live. As you do come into this live, as you enter, let me know that you're here, that my sound is okay. You can do like a hi or a hashtag live. And if you're watching this on a replay, all the same stuff applies. Ask me a question. I see everything that goes on in this group. I'm very active in here. So feel free to type stuff out. And, anything that comes to mind around open heart surgery, please just let me know. All right, I'm seeing that there's people can hear me, which is great. I'm going to just pop my notes open and kind of pivot in and out of that to make sure I can still see questions, because sometimes I can't see questions on my phone, which is where I'm looking at right now for some odd reason. So I'll just be moving in and out between Facebook on my laptop and my notes. All right. Open heart surgery. Like I said, this is a pretty significant scar. There's a lot in play here. So every scar video that you see, probably you've seen a few by now, I always touch on the physical considerations. What do we need to think about physically related to this scar? The second thing we always talk about is the emotion and the energetic considerations. What do we need to think about emotionally related to this scar? And then the last thing, which in the era of information overload, is a very useful and important piece for me. I want to really make sure that women inside this group feel like they're getting the info, but they're also getting a place to start. So the third part is how to begin, what to actually do. The first step I give in all SCAR videos, and then I'll give you something specific directly pointing at how to start working your open heart surgery SCAR. So with all of that background done, let's get into it. The physical considerations. Like I was saying at the beginning, this scar is in a very significant position. It's usually like, depending on how like when you got the surgery and the type of extent of the open heart surgery that was done, it's usually between like 6 to 8 inches, which is kind of like your whole sternum. They actually, as far as I know, still like drill through and open up the sternum as their primary entry and access to the heart. The rib cage, as you probably know, houses the heart and the lungs. And it's like literally a cage, because those organs are incredibly vital to our moment-to-moment health. If something goes wrong with our lungs or our heart, we're not in a good place, and we're not going to be, we won't last very long being alive as humans if something goes wrong with those two places. So this area is really like a solid cage. However, this cage, the rib cage, if this is the sternum, like let's just draw a line on my body so we kind of know where the sternum is, it's very hard. Just neighbor to it, you have a pretty significant size of cartilage. Then the rib attaches into the cartilage, and then the rib comes all the way around and it attaches into your thoracic spine, your middle spine area. You have 12 ribs that are doing that. All of this area here, like kind of in the front, is a lot of cartilage, and that gives us a lot of movement that should be happening with our breath. This is really important because the rib cage, yes, is like solid in housing, but it also needs to be very dynamic in like accepting to our breathing. And as you know, or if you don't, I will say it again, scars really like challenge the ability of stuff to move. When we have scars on our body, it's like a bunch of layers of Spider-Man's web, really, really ingrained in that whole area. And it really inhibits natural ease and movement that should be in the body. So everywhere in their body, in the body, your body, there should be a natural kind of slide and glide mechanism that I talk about, where everything should be interacting with its neighbor. Meaning with a single breath, there should be expansion, opening, lengthening, creating a space, as well as the exact opposite of all those things, kind of like a closing in, narrowing, coming back together. But even bigger than that, there should be muscles that are accepting and accommodating. There's going to be nervous tissue like nerve, artery, vein, ligament, tendon. Everything should be kind of interacting and sliding and gliding amongst itself. And if there's scar tissue there, that is greatly inhibited. It's challenged to a very big or small degree. Because the surgery, the open heart surgery, is right on top of our rib cage and our diaphragm, it really impedes that natural function that needs to happen. So one of the main things I want to just highlight as a physical consideration is how much this scarring will challenge our breathing. So poor breathing mechanics is already scientifically like locked into, if you have poor breathing mechanics, I think the chances of you having cardiovascular or heart health problems is like some crazy number. I read it in a book recently. It was something like 90% or like 95% of people who have heart problems or cardiovascular problems also have a breathing dysfunction. And this is really important because we want to make sure that after the surgery, we are really on point with bringing this natural movement of the rib cage back. We may not actually have had it prior to the surgery. Maybe we've had breathing problems for a lot of our life. Maybe not. Maybe we do have them and we didn't even actually recognize that we have them. But I want to highlight what that means. We want to be breathing low. We want to be breathing deep. We want to be like taking air into our abdomen, not just by like pushing the belly forward, but really experiencing like an inflating of a party balloon, meaning there's opening on the sides of the body as well as the back, as obviously the front. This kind of downward expansive breathing helps activate the diaphragm. Diaphragm is incredibly important for proper breathing mechanics, but also cardiovascular health, also mental health, also the way that your nervous system functions. It takes us out of that like grippy fight or flight term that we're really kind of used to hearing now, that sympathetic, and it really drives that down into a more relaxed kind of state. It's very calming and soothing. So we want to like work this back into our body. Absolutely. Hey, Leslie, nice to see you here. So this is so important with the breathing mechanics. We've lost that with the scar. We may not have even had it before. Maybe we lost it somewhere else on the way, but we absolutely need to work to bring that back, and we need to create some movability and adaptability on the scar itself. So I talk about scars a lot as being like if you open up a textbook and you like look at the appendix and like the definition section and look at scar, they'll call scar inert tissue. And what that means is they're defining it as inert because it has no properties that are easily like plugged into our circulatory system. Meaning like our muscles have very good circulatory interaction. Like there's nervous system stuff and like blood flow like plugged right into our muscles. That's one of the reasons why when we have a muscle strain, it's usually like a short-term problem in like the span of things. If you have a strained or pulled nerve, like a nerve problem, that's a very long, delayed, slow healing process. Muscles like really short and pretty insignificant. And so with a scar, there's no direct like circulation going in there because it's something we didn't have before and now we do. It also is intentionally being fibrotic in nature because when we have an opening to the external world, and in the case of an open heart surgery, a huge opening to the external world and probably some of the most vital organs in our human body. Whoa, that's intense for our nervous system to feel. That's intense for our whole body to be, a part of. So it wants to close that gap quite quickly. It's very painful. They're cutting through a bone to get there. It's very significant. And so that scar tissue that is all through here will be very dense, very fibrotic, very like dehydrated. It's very hard. And so we want to work the scar over time so that it is not that, because it doesn't need to remain inert like the textbooks will read. In my experience, scar tissue is definitely not inert. There's a lot of ways to bring some pliability and some openness and some softness and really lay that scar flat and sometimes make it completely disappear depending on where it is and the process and all of these other factors. I've worked with many people where they had massive scars on their body, and through working through them, they go almost invisible, which is one of the benefits, but it's not really the reason why we're working the scar. Why we want to work the scar is because we want to liberate all of these like really severe and significant symptoms that we feel on a day-to-day. So what are some of the symptoms you may feel on a day-to-day with an open heart surgery? You may feel, let's start at the top and work our way down. You may feel brain fog. You may feel easily fatigued. You may feel like easily dropping in your energy, like energy dips. You may feel difficulty concentrating or focusing, decision fatigue, any kind of like chronic congestion in the face, like sinus stuff, allergy stuff, ear stuff, tension in your jaw. These kinds of things could be going on. And a lot of tightness in this area, neck and shoulders. Why? Because it's very likely that we have poor breathing mechanics either because of the scar or before. So if we're not breathing like deeply into our abdomen and our diaphragm, like I spoke about before, where are we going to do it? We're going to do it above. Above is what's related so closely with heart disease and cardiovascular problems. And so sometimes when there's a scar there, it gets even harder for us to breathe because like we never got trained to breathe here. Then we have a scar here and it's hard to open that up because it's all dense and fibrotic and like squeezing us in. So then we start to breathe through these like muscles in our neck and into our like top part of our rib cage. That is so uncomfortable. That is really not the best place to be breathing because I want you to picture like your lungs like kind of like diving tanks, like oxygen tanks, where they get really kind of narrow and small up at the tip, at the top of your rib cage, and they have quite a large wide base at the bottom. We want to be able to pull air into the bottom of the lung, not just like getting 10-20% of our like biochemistry exchange going on here. We want to get it like all the way into here. So you may feel a lot of tightness, tension, chronic stuff going on in the shoulders because like everything in your body is like, oh God, I'm trying to breathe, because we need to breathe obviously to be alive. So that kind of stuff, you could have joint ache, joint stuff, neck stuff going on like that. Then obviously if your breathing mechanics are off, breathing, I want you to visualize breathing, if you're breathing properly, like in and out like this, like a diaphragmatic pump, it's naturally just, I like to call it, when I talk to my clients, I like to think of it like you're giving your organs a massage, like a nice gentle organ massage with every single breath. The diaphragm on the top is connected to your pericardium, which is the outer covering of your heart. It like encloses the heart. It's like the protective connective tissue. That connective tissue is directly plugged into your diaphragm. So every single time you take an inhale and your diaphragm drops, you get a tug, a nice, natural, proper, good tug on the heart. When you take an exhale, you'll feel that same kind of tug sensation, but happening at your liver. Sorry, I'm like looking at myself and then touching my body in the wrong way. On the right side of your body, which is your liver. And your liver is attached to your diaphragm on the bottom. So every time you get an exhale and your diaphragm comes up into this dome shape, your liver gets a nice natural kind of like tug up. That's good. So that's happening directly because of the attachment fibers, like the fascial system on the diaphragm. But every time you're lowering the diaphragm, it's pushing your organs, and what happens is everything opens up and goes down to accommodate for that. And when you exhale, everything kind of returns back in towards the center. So just breathing can help your digestion, can help the health of your bowels, help the health of your bladder. And like I've said before, anything that's happening on the torso is going to be a pressure problem. It creates a pressure issue in your body. And when you have a pressure problem, it can create feelings of like vulnerability in your joints. So you may experience low back pain. Another reason you may be experiencing low back pain is because proper diaphragmatic breathing actually gives you a lot of like joint stability. It's one of the ways that you can like constantly check on and maintain your house, so to speak, because your diaphragm is quite literally like chopping you in half at this point at the bottom of the rib cage, and when it is moving correctly, it's giving a proper kind of biomechanical movement to all the joints above and below. So back pain is something you also want to think about. All obviously, so back and pelvis are closely related. So pelvic pain, nerve stuff, sciatic-like symptoms, all of these things can start to kind of go off because the whole kind of tendency of this scar is to kind of drag and pull us in like this, like this. So those are the things I want you to really think about here, and also pressure-wise, pelvic floor stuff, incontinence, feeling like there's a pressure problem, like an urgency problem, maybe feeling like women say this pretty often, like their organs feel like they're going to fall out of their body if they let go of their pelvic floor. So there's a lot of clenching and so on and so forth that can happen. And it's because this area is not being very adaptable because of the scar tissue that we need to work and train a sense of like openness here that can come with physical properties of working the scar, doing proper movement, doing proper breath practice, but also coming into the energetic and emotional considerations, really healing that hurt in this area related to your actual heart, like emotion, but also just bringing in like a type of posture that gives your energetic body like a different sense. If you stand and kind of are kind of curled in where the scar is kind of going to grip in and hold you, that gives off a very different vibe. If you just crunch and give yourself bad posture now, that feels like a whole different feeling, like in my own just energy, without talking about woo-woo-ness, but just I feel enclosed. I feel like isolated and like separate. I feel kind of afraid. I don't feel good. When I just sit like this and I have a bit more open chest and I immediately feel a little bit more confident. I feel more open. I feel more relaxed. I feel like less tension, like here, just like kind of it feels uncomfortable. It feels unnerving. Whole totally different world. So we need to do that as well from an energetic kind of perspective of how you're just holding your body. But we'll get into that in a second. Let me just check these physical considerations. Talked about breathing mechanics, problems with pressure, the scar formation and what it does to your posture. And then, yeah, really just breathing is creating an ideal type of stability for your spine. And if your spine is resting in the correct alignment, then all your limbs are in a better place. If your spine is off because of a scar, then it's like the foundation at which your limbs are resting on is slightly skewed. So we always want to make sure that we're getting some proper movement and ideal kind of alignment in our spine. So physical consideration, I just kind of danced around them, but let's get into them more. The energetic and emotional considerations, let's get into those. Obviously, so right into an important spot. Every type of old tradition, Eastern medicine, shamanism, all types of other, old traditions, they're all talking about this heart space. They're all referencing this same area. And a lot of those traditions, they weren't talking at all about the physical heart. They're talking about all human beings have this heart energetic center right in the rib cage. center of the rib cage. So we want to think about that as it relates to our emotion, our energy. What does that mean exactly? Just doing some self-reflection around how does it feel in your body when you're thinking about being compassionate or being grateful or having, are you easily able to access love and those type of warm feelings? Or is it more of a natural tendency for you to feel tight, to feel rigid, to feel constricted, to easily get, irritated? All of that is something to think about as far as heart-centered. We want to heal as much as we can so that we are naturally more responsive and able to open up our heart and feel those, wonderful expressions like compassion and gratitude and love, joy. All of those things are obviously, we want to be feeling those as humans. It's good to feel the other stuff too because we are humans, but we want to really have access to that. We want to check that that's part of who we are. Then the other thing I want to talk about is just the heart channel. So in Chinese medicine, all of the organs have a channel, like an energetic channel in the body, and the one that's related to the heart is in the arm. It's in the arm, and it actually finishes in the pinky. So there's actually an energetic channel. If you've had acupuncture, they will potentially be putting needles into any of those points along the way. And the kind of emotion or energetic vibe around this channel is heavily related to feelings like abandonment or betrayal, like, those like heart punch kind of emotions. Betrayal is a big one. Abandonment is huge. Feeling lost is also another very common theme for people who are having heart issues. Check in to see if that feels real or if that resonates with you in a small or a big way. Also, just checking to see if there's anything going on like this part of your arm comes on like across the front, the kind of like elbow crease side of your arms, both arms. And we kind of know that because in Western medicine, we have the diagnosed heart attack referred pain, like the organ pain for the heart, the referred pain pattern is into the left arm. So that's also just something really interesting that kind of parallels Western with Eastern style medicine. So just on this energetic posture, we want to be just really aware of how we're holding ourselves and just what the scar is actually like dragging us into. It's going to be dragging us into an inward direction because that's what scars do. Imagine like a bunch of wads of gum kind of straining and pulling on our anatomy, all parts of our anatomy, especially here because it's bone. It can start reshaping the way that our rib cage is. That's not to say that you can't move it back. I've seen a lot of really amazing things happen depending on your age. Like I said, this connective tissue part that's like soft cartilage is why we can expand and open and close the rib cage. Over time with age, our rib cage becomes a lot more fibrotic because as a general theme as we age, we just kind of dry up a little bit. And so we want to keep that adaptability and like robust amount of movement in our rib cage as best we can. And we can do a pretty good job of that with just full breathing. And then if we have a scar here, which I think a lot of us do for watching this video, we're thinking about how can we work this scar. This scar, energetically and emotionally, is significant. It's a significant surgery, and it feels significant before, during, and after. The healing process is long. The location of the scar itself is a place that you often see. It's maybe you're having to choose your clothing in a particular way. It has a very lasting effect. Maybe after the surgery itself, you had to go on medication that you will be taking indefinitely, and so on and so forth. So there's a lot of stuff wrapped up inside the scar as an after phase. And during the surgery itself is a very significant scar that the surgery is, potentially a fatal one. That's a huge deal. That brings in a lot of emotion. And then we want to think like the before. This is where a lot of healing can come into. what was going on in our life before we had booked the surgery? What was the general vibe of our life situation? Were we feeling betrayal, abandonment, loss, those kinds of heavy emotions? What was going on? Or do we have a tendency to be very tight, be very rigid in our thinking, be very rigid in our body? All of these things, whatever they are for you, are really good kind of self-reflection tools to really figure out what it is that you can start to work on to fully resolve any kind of lasting, lingering, emotional, energetic stuff related to the heart. So that's how I always talk about the energetic considerations through these three phases: the before, everything that happened before the surgery, the feelings you felt, the emotion, the kind of energetic vibe, the situation in your life. What was going on? Uh, List that out, write it out, think about it, go for a walk with it, whatever feels good for you. Then the during, obviously the during the surgery, like I said, is very significant. And then the after. The after, I would say almost all the time for open heart surgery, it's going to be right up to present day, because a lot of women don't look at themselves in the mirror when they have a scar. And because the scar is in a very kind of like open, overt place, that can feel really overwhelming. So all of these little things will play into how you feel today. Like what's the energetic vibe, the emotion, the situation that you're in today. A lot of people who have these significant surgeries, it's like almost like a wake up call, or like a really nice, like some people, which is amazing. They see it as a life changing opportunity, which is awesome. And so it doesn't necessarily have to have this doom and gloom kind of vibe. It could be like a really amazing thing that kind of turns your life around situation. But knowing all of those steps in between the path is really important. Super, super important. So I think that's what I want to say for the energetic considerations. If anyone has any questions on any of those, let me know. Let's get into the what to do. The what to do for every single scar. Let's just go through this. I have to say it because I don't want anyone to miss it. And what you're going to do is you're going to do a 3-part practice that is involving you sitting or laying in a place that is comfortable. So phase 1 is like the relaxing into, or the part 1. So you're going to sit or lay somewhere in your house or somewhere that you feel comfortable to get into this work for about 10, 15, 20 minutes. Then you're going to make skin to skin contact with the scar. It's really important that you activate the power and the sense of touch, and acknowledge that you are touching yourself in a place that probably has a lot of hurt, a lot of tenderness, a lot of raw emotion, a lot of just physical sensation or lack of, maybe numbing, but you're meaningfully connecting and touching with the area. Then you close your eyes. So that's the whole setup for part 1. Then part 2, you're grabbing the physicality of the scar in all the different ways that you can. So you're going to be just like touching or feeling the scar, however long it is, and you're going to be feeling for places of altered sensation is a good place to start. Where is it numb? Where is it like hypersensitive? Does it make you feel icky inside? If you have any metal feeling, touching metal on your body, generally people have an aversion to that, makes them feel icky, nauseous, all kinds of words I've heard before. Just acknowledging and paying attention to that. Temperature differences, hot, cold, and obviously all the physicalness that you feel, meaning like ropiness, stuckness, places of tension, puckering, stuff where the skin is like coming out or like held out. Then the opposite, places where the skin is like grooved in and really like held into the area. You want to feel all of those things as much as you can. Then the third part, which is the final part, is you want to grab the emotional and energetic considerations from these 3 phases. Okay, this can be, because it's kind of a longer progression, depending on how long it's been since you've had the surgery, this may take a moment to really kind of rest into this experience. All that emotional feeling, circumstance before the surgery, during, and then after. Really paying attention and gathering as much information as you can. So that's the thing that I want you to do for every single scar. Don't do every scar on your body all at once because that's a bit overwhelming, especially when you do this one. It will be a significant scar. It has changed your life since you've had this scar. So you need to acknowledge that this is a big deal. Doing scar work is not just a fun thing that you can do on a Sunday afternoon and like another thing to check off your list. If you do scar work effectively and you follow my system and if you work with me, particularly in a group or one-to-one format, this is like transformation potential. Like what you can do to your body and your mind by working your scars is absolutely incredible and life-changing. So we want to be respectful of our timeline, honoring our body, really applying this whole process with a level of kindness, gentleness, softness. It's like it has to be done. There's no way about it. Then what can we do to start working this scar in a way that feels like a gentle walk into the open heart surgery is we need to learn how to breathe again. And depending on who you are, you may feel like, man, breathing practices are so boring. I don't like them. I don't get them. I don't know why we're doing them. And uh, that was me a while, that was me for a while. I would say that was me. I didn't quite understand the depth at which a breath practice is. I didn't really understand what breath work meant. I get it if you feel that. However, if you really take this breathing practice seriously, it can bring about incredible healing to some of those symptomology, some of that stuff that I was explaining before. And that was just the physical kind of symptomology that we went through from head to pelvic floor. So the breathing practice is really simple. It's going to help us bring back diaphragmatic breath and all the positive benefit of that, like feeling stable in your body, feeling connected, getting proper biochemistry exchange. So getting proper oxygen dragged down into the right places. Help to work this scar indirectly from moving it from the inside out. Give your organs a massage. Let them go back to doing what they need to do. Every organ has its own kind of pulsation and kind of articulation that it makes on its own, but with its neighbor, which is a lot of what osteopathy and these types of practices and therapies are pointing towards in this one of their like main things that they do in their practices. So getting that organ movement back, feeling that you're resolving some pressure problems like headaches, like pelvic floor stuff, getting some of this tension to dissolve, feeling most importantly as an energetic kind of symptom, feeling that you're starting to come back as like a unit, feeling yourself as whole, like integrated. When you've had a big cut in your body, whether it's breasts, chests, abdomen, you feel like, or you could feel like you're in pieces, or like you're thinking about yourself in like compartments, compartmentalizing yourself. Maybe something that's just happening in your head that you don't even know it's happening. So diaphragmatic breathing will help change all of that and more. How do we do it? Okay, so you want to breathe down low. First, before you do that, you have to acknowledge the way at which you are breathing. So it may be right now that you pay attention to this, and I suggest checking in like multiple places during your day, asking yourself how you're breathing after a not so great conversation with someone, while you're driving, while you're going for a walk, while you're making a cup of tea. So you really get a good grasp on your natural way of breathing. We want to put and pull the breath down into here, into our abdomen as much as we can, and inflate in 3D. So through this plane, side to side movement, through front to back movement, and through this movement, up and down movement. We want to inflate in all the directions. We want to limit movement here as a primary. Breath will come up here, absolutely, but it only happens through here when it is kind of at its limit or stretched out to its max through the abdomen. So I like to put my hands, one on the abdomen, one on the chest. You kind of get like a nice twofer with like hand contact on the scar. And you want to be breathing in this direction. Okay, I'll show you with my hands. First, assess how you're doing it. You could assess just with the hands off, or you can assess with the hands on. But I'll show you the actual breathing practice itself. You're going to inflate from low. Ideally from below your belly button, like your low abdomen first. Feel like that is moving in all the directions. And then as that's happening, this hand will lift. So place to pay attention to, and you breathing into first. Here, 1. Then all of that abdomen gets filled. The diaphragm is dropping. This is all expanding, lengthening. So 1, and then as that fills, 2. Then you start to feel your chest breathing. Then you start to feel like some room in your armpits. Then you feel like your chest and collarbone area is starting to inflate. Then you're at the top of your inhale. Great. You should feel like you really are at the top of your capacity. Then this, because this is like closest to your nose where you're breathing from, air is going to leave from here first. So that means that this lowers first. So we go 3 back to kind of its rest position. And then here, back to its rest position 4. So inhaling, top of the inhale, exhaling, bottom of the exhale. Just in that direction. And putting my hands here. But really we should be feeling it like this, from all sides of the body. Don't just be pushing out your abdomen. That's not so great. That's just like pushing your belly out. Really feel like you're stretching that tissue. So good for so many reasons. That will start to indirectly start, like I said, move the scar from the inside out. So diaphragmatic breathing, slow and smooth. You may feel lightheaded because you're getting all this change in your biochemistry that you're not used to. So just be aware of that. Like when you get up to stand, take it easy. Make sure you are stable and you know where you're at before you start moving. And do that for 4-5 minutes. You don't have to do it for really long. Just start to train that in and see how that feels over time. You should receive some incredible benefit just as a starting off point, training your body to come back to its natural way of breathing, really removing that breathing dysfunction and bringing a proper pressure back into your torso. So if anyone has any questions, I would love, like I say, to hear them. Just gonna make sure that I can see stuff, which I think is important. And yeah, if a question does come at any other time, just let me know. I'm very happy to answer them in a typed form. If you don't want to ask me a question here, that's okay. Send me a message. Very happy to answer as well. It was nice to have you all here with me. And I will see you. I actually have a really exciting announcement, so I'll probably see you later this week. I'm going to pop in for a live and just share my excitement with you. So thank you for being here live. It was lovely and wonderful to have you and to help. Let me know if this video was useful for you, and I will see you very soon. Bye.